How does the bladder's structure help it work? Imagine a balloon that can stretch and shrink without losing its shape or strength. That's essentially what the bladder does, thanks to its unique structure. The inner lining of the bladder is made of a special tissue called transitional epithelium. This tissue can stretch a lot without tearing, which is crucial because the bladder needs to hold varying amounts of urine. When empty, the lining forms folds called rugae, which flatten out as the bladder fills. This folding allows the bladder to expand from about 50 milliliters when empty to over 400 to 600 milliliters comfortably, sometimes even up to 1,000 milliliters. This elasticity prevents pressure from building up too quickly, protecting the urinary tract from damage and reducing the urge to urinate prematurely. Just beneath this lining is the submucosa, a layer of connective tissue that contains elastic fibers, blood vessels, and nerves. This layer supports the mucosa and helps the bladder sense when it is full. When the bladder stretches, nerve signals alert the brain, letting you know it's time to go to the bathroom. The middle layer of the bladder is made up of smooth muscle fibers called the detrusor muscle. These muscles are arranged in multiple directions, which allows them to contract forcefully and rhythmically during urination. Because they are smooth muscles, they work involuntarily, meaning your nervous system controls them automatically, ensuring the bladder empties efficiently when you decide to urinate. At the base of the bladder is the trigone, a triangular area that is smooth and fixed in place. This region is important because it helps prevent urine from flowing back into the ureters, the tubes that carry urine from the kidneys. Small mucosal flaps act as one-way valves at the ureter openings, stopping urine from refluxing, which can lead to infections or kidney damage. Surrounding the opening of the urethra is the internal urethral sphincter, a band of muscle that keeps urine in until you are ready to release it. Voluntary control is provided by the external urethral sphincter, made of skeletal muscle, which you can consciously tighten or relax to delay urination. The outer layers of the bladder include supportive tissues like the adventitia and, on the top, a layer called the peritoneum. These layers hold the bladder in place within the pelvis and help it maintain its position despite filling and emptying cycles. The bladder is also richly supplied with nerves from the autonomic nervous system, which coordinates muscle contractions and relaxations. Stretch receptors in the bladder will send signals to the brain when the bladder is filling, helping you decide when it's time to go. Understanding this complex structure is especially important when considering bladder health and bladder cancer. The transitional epithelium, while flexible, is also where most bladder cancers develop, making regular monitoring and prompt attention to symptoms essential. Overall, the bladder's layered design, its stretchable lining, supportive tissues, powerful muscles, and control mechanisms, works together seamlessly. It allows the bladder to store urine safely, prevent leaks, and releases urine efficiently, all while protecting the urinary system. This intricate design highlights how vital proper bladder function is for overall health, and why maintaining bladder health is so important. If you have concerns or notice changes in urination, always consult a healthcare professional for personalized advice.